Thank you very much. It's great to be talking to you. I apologise in advance that I'm a bit snuffly today. I'm just on the back end of recovering from a bit of a cold. So I hope that I can still communicate to you clearly. Now I'll just check that this progresses the slides. Terrific. Okay, that's helpful. Yep, everything works. That's great. It's always good if the technology works. You can see here a little bit about my role. I'm the chair in health psychology, so you might think, well, what is health psychology? If you think about it, it's very important that we understand human behaviour and how that might apply to things that we can do to improve our health. And so I'm going to talk to you a lot about that today, is to try to recruit your interest in the idea that there are things that we can do and we can take control of that might lead us to be leading a healthier life, and also to be role models, I suppose, for the communities that we serve. And I'm going to talk a bit more about that side of things as well, the idea that there's some things we can do to take action that might lead ourselves to be healthier, but also we are thinking today very much about our rural and regional communities and how can we be of service to those communities. I'm from Deakin University, so we're just at the back here, and we know that that there's increasingly what we're trying to do really is build a partnership between Deakin University and your college, Marcus Oldham College. So that's something that began last year, where we've been in discussions, and we're putting work into that. We're very keen on the idea that we'd like to work together. I'm also from a background where I've done a lot of work on the issues of child development, and I'm going to talk to you a little bit today about the idea that some of the solutions to the problems that we wish to see improved around health and wellbeing in rural and regional areas can be addressed by realising that the way our health is today is the product of a lot of experiences we've had really pre-birth, and some of those things where the action will be in terms of making sure that we continue to lead healthier lives each generation. So a fair bit to try and cover. I'm also aware that I've got to I don't want to be keeping you too long, and you can keep me to time. Let me know when I've got 5 minutes left. So I'll try not to take too much of your time today as I'm presenting all of these things. So here we have, this is a graph showing you some trends in urbanisation, and the main reason for presenting this is to show that there's been a real trend for us to move into big cities. We have now, in Australia, there's 31% that live outside the capital cities. And so this has been a trend that's happening internationally. Obviously, it's an important trend. It's something that you would all be aware of. It's affecting, you would probably know more about this than anybody, and that's the reason that I'm actually going to ask you the question to tell me why are people moving from the rural and regional areas into the urban centres. So now it's a chance for you to exercise your voice, and that'll be another aspect of today, is we really want you to tell us what you think. What was that? Work. Okay, so one of them is that the work tends to be in the urban centres, so people are moving for work. Another reason, yes?
Well, a huge problem in China. 750 million farmers, average of 2 acres, all moving into the city because they don't want to work so hard as they have had to do in the past. And there's good money in the city.
So they're trying to get away from a past they're trying to go to a future that they think will be better than the past was. The past was a lot of hard work and maybe not a lot of reward. Other reasons?
Just lack of healthcare facilities and
the cities have the infrastructure, and the modern infrastructure is attractive. So that's another one. I'm going to ask that students sort of, even if you feel a bit underconfident about voicing your opinion, it's actually important that you do, and we won't sneer at anyone who says something that there's no disagreeing. It's safe to talk today. So what are other reasons that people are moving? Yes. Yeah, a very important one is education. So if we think about those things as being the reasons that all this is happening, we can begin to understand that we're living at a time where people are moving around a fair bit. It's part of the picture of what's happening in our time. So now the next question is, what are some of the health trends outside the urban centres? Now obviously that's got to be a focus of today. And again, I'm going to get you to tell me, and if you've got all the answers, then I don't need to speak any further, I'll just step down. So, what are some of the reasons, some of the health trends that you're aware of outside of... So what's going on in the country areas in terms of overall health? How is it going? What are the trends? Sorry? Not good, are you saying?
Oh, there's an increase in obesity.
Okay, so...
Disease.
Okay, so we got one of the problems. Okay, so you're saying that it's health and mental health are not so good outside of the urban areas. They're a bit worse. In fact, and you mentioned obesity. So after me, you're going to be hearing from Dr. Lynn Miller from Deakin University, who'll talk about that issue. What else are you aware of? Sorry.
The services, health centres, available as doctors, all of those things are being cut back and doctors are moving away.
Right, so obviously again, people mentioned earlier that one of the reasons people move to the centres is because, the urban centres, is because there's more infrastructure. And so that's one of the issues for regional rural people, is that there just isn't the health services are not matched, and so that does lead to a decline in health. So that's one of the issues. Students, is there anything else that you think about in the health domain? That yeah, over there. Sorry.
Significant health issues in the area.
Yep. That's right. So what sort of things do you think of when you're thinking of those significant issues? So that's a big one, is people are having those mental health issues. So they're there. Is there anything else people would like to mention? Yes?
Thinking about that program on the broken hill, there's a lot of people with broken bones and they cut bits of
Right.
themselves.
Yep.
And they're relying on doctors and things like that.
Okay, so the injuries is another one, and we'll see that that's actually a bigger issue in rural and regional areas. Some of those are to do with the nature of life in rural regional areas. As you say, you mentioned they're being injured in sort of work-related accidents. There's obviously longer distances of road that have to be travelled in the rural regional areas. People mentioned earlier the nature of the work, and so we'll come back to that theme a little bit. So if we think about it, the college that you're at the moment, where the career that you're embarking on, so again, this is trying to get ourselves into the thinking of why is this guy talking to us today, is actually a leader nationally in setting the agenda in the way the workplace will be in rural regional Australia. Now, not only that, but you also have quite a significant group of people that are already graduates who are out there, and they're your network that you're going into. So what I want to put to you today is what I'm going to show you is actually, it is pretty negative in the sense that it's not a very happy picture about the difference at the moment. It's actually quite a bad picture in rural regional Australia in terms of health issues. But I want to also say, let's not leave it at that. Let's talk about solutions, and let's become the action for change that I think is needed. And I'm going to talk a little bit more about that. And I'm serious when I say that, because I do believe that we can form a partnership whereby, as you graduate from this college, that you can develop some skills to take out that can make the difference. And actually, this doesn't need to continue, that such a big difference in health outcomes. I think we could make a difference. So I'll say that on an optimistic note, but I probably can't make that completely real today, but we'll touch on some of those solutions. So yeah, that's the bad news, is that the trends on a range of health indicators that I'm about to show you show worse outcomes for those outside the urban centres, and we'll talk a little bit about those trends. So firstly, the overall good news is that there are solutions to a lot of the health problems that we face. We could actually have much better health if we took the advice from the good evidence we've now got. So one of the issues is tobacco use and smoking. That's actually something that is a trend now in Australian society. There's a big trend to get off the smoking and get out of it, but it's just that it's lagging behind in the rural regional areas. We're slower in the rural regional areas to take up these health trends than is occurring in the urban centres. So if we think a bit about that, we can see here data that shows back in 1980 there were a third of us who were committed smokers, and that was pretty stable there. That had been actually something that had been quite high, even higher than that since the post-war years. But it came down through deliberate efforts such that by 2010 the figure was down to 20%. In fact, now, if we look at the most current figures, we're getting it down to the 16-17%. So it's actually going quite well in reductions. But when we look at the figure for the outside the urban centres, what we discover is that it's really lagging 10 years behind in terms of the progress of the change. So there's something there that we need to think about that's about the movement to take on healthy behaviours. We're lagging and we're slower to do them outside the urban centres. Now that might be partly about the fact that maybe the health education messages, maybe we need to become more proactive and early adopters of those if we want to really lead the change we need to lead in our rural areas. So that's the first message. Smoking is actually a huge killer. It's a very important cause of health problems. It's one of the biggest things we could do to improve health is to actually get ourselves out of that behaviour. So that's the reason that as a health psychologist I mentioned the smoking issue. It's a very important one. Alcohol's another thing that is a big cause of problems in Australia, preventable health problems. It's one of the big three next to obesity and smoking. And we've actually, again, made some progress in Australia in sending the message overall that we've got to actually reduce alcohol use down to more moderate levels. But again, the trend is less evident. The trend towards healthier behaviour in alcohol is less evident outside the urban areas. So there's the trend. It is showing a decline since 91. These are the percent of us who are using alcohol every day is actually coming down in terms of the overall percentage. It's not a huge drop, but people are starting to realise, well, there's some moderation that's needed. It's one of the things to say about alcohol is that if you can have breaks from it, if you have periods where you don't use it at all, it actually is very good because it can reduce that sort of habitual nature of it. Alcohol is something that has a dose effect, so the more often that you drink it, the more that your body can tolerate, and the more that your body tolerates, that means that more likely is that you're actually doing damage to your liver and other organs as it's trying to deal with the amount of alcohol. So all things being equal, it's actually good to do things like the Feb fast, and some people do the dry July, etc. Going for long periods where you just don't use it at all can actually reinforce to you that you're in control. So, and that's another message that you don't hear as often, in addition to the message that you do hear a lot, which is don't drink too much. Actually, not drinking at all for long periods is a way to actually reduce how much you drink and get in control. But the message here is that the binge drinking is actually a lot higher outside the cities. It's 26% in the regional areas compared to 15% in the cities. This is based on Australian Institute of Health and Welfare national findings, and we've found the same thing in the studies that we have conducted from our health research teams at Deakin University. The other issue that was raised earlier is injuries. Is actually the figure is double the rate. So it's double the rate of injuries outside the major cities. And again, people have mentioned some of the causes of those injuries. Again, there is a progress being made in Australia in reducing injuries, and we do that through analysing when an injury does happen. I don't know, I'm sure many people here would know of people that have been injured in cars or injured at work, and if that's someone in your family network or somebody who you know and you're close to, which often is the case in rural regional communities, when these things happen, they're horrific because they affect so many people and they're very vivid to us. So we know each of those, when I think back about the people and how they've been affected by these death or disability that can occur with a perfectly healthy person, it's horrifying. But the way that we've tended to react to that is to analyse how the injury happened and try to prevent it happening in the future. And that's actually a very good strategy. It can work quite well. But you need to realise when these events happen that you need to sort of take on board when people like me are standing up in front of you and saying, look, let's change certain things that we do. We're saying them based on that same theory that actually it's analysing events that lead up to things like cancer from tobacco use or injuries that can be related to alcohol use, leads us to be up here talking about let's get those causes down. So it's not just an academic exercise, it really is that many things can make a difference to very bad experiences that people otherwise have. Those bad experiences can end up with, people have mentioned, higher rates of mental health problems. The issue in the non-urban centres is really to do with the fact that you're having longer experiences where you do have something like a terrible grief or loss that you might be facing through things like injury or trauma that others have experienced or you've experienced, because there's not so much service here and since longer periods with that burden of problems. So that's one of the issues that we do have in the rural regional area. So we need somehow to be able to get the services out there. And now in the modern era with the use of electronic communications, it's possible that we could improve access to mental health services. Now I'm going to talk a little bit, starting to talk about why things are as they are and what the solutions might be. So because of my background, and I've been an expert in child development issues and trying to study that aspect, I'll talk a lot about solutions being, let's make sure that I'm talking to a lot of young people today. Many young people will go on soon to have families. So I'm going to talk a lot about a game changer could be if we could just raise children and ourselves as young people be leaders. We need to care about older populations. We do have a lot of people retiring in rural regional areas, and there's other issues that need to be looked after there. But this is one of the things that could be a game changer if we could actually look at the issues as we're raising children. So what are some of those issues? One of the problems is that we need to make sure people have a very good education. At the moment, a lot of children are entering school not really very ready for school. So this is from a report called the Australian Early Development Index, which is done nationally, and it's repeated every few years. And this is showing that, particularly in the remote areas, that there's problems with children being ready for school. And that goes back to issues with things like alcohol in pregnancy and smoking during pregnancy, these things, and also the other things about raising children that can actually get them ready for school are very important things to do, such as being able to read to children from a young age. And sometimes if we're in very busy jobs and under a huge pressure, we might not have the time to put into those sorts of things. But it's good to know at least that if we could change those things, that would make a big difference as children are growing up. This is related to the fact that at the moment I'm presenting to you findings from a study. We do very large studies across Australia following up from childhood into young adulthood. This was a study in Victoria that we've recently completed. We're noting that of the almost 3,000 children that we studied that went through secondary school in Victoria, they're now in their early 20s, there's a 37% lower rate of school completion in those in the regional areas, and a 47% lower school completion if you went to school in the rural areas. So again, this is not good enough. This is after controlling for a whole lot of other things that are going to affect your involvement at school. Just where you went to school seems to have a huge impact on your likelihood of completing school. That can change. We need to change that. Again, you're in an educational environment. This is one of the places where maybe that can be different. Alcohol's another big issue. In secondary school populations across Australia, this is national data, there's been a reduction in the number of young people drinking. It's actually quite it's a startling reduction. Sorry, I suppose you need to look at the overhead. And you can see that in 2002 there were 29% of children 12 to 15-year-olds who said that they'd drunk in the last week. That's dropped down to 11% here by 2011. So it's actually quite a remarkable drop. Young people are getting off the alcohol in secondary school. They're getting the message that it's actually not a good thing to be doing. But actually the trend is much slower in the rural areas, and we really want that to change. So in the secondary school areas, when we did our studies, we found there were 31% a greater likelihood of the use of alcohol, cigarettes, illicit drugs. And again, alcohol's a big factor. If you're drinking in the secondary school period, it creates a liberal environment that makes you think it's okay to do other things. So kids are much less likely to use ice if they've never used alcohol. So again, there's a message here that we need to really take home, which is about let's adopt the idea that children in secondary school particularly should not be using alcohol, that we won't buy it for them, and if we're parents that we won't provide it for them. It'll make a big difference. Other major issues that emerge in the rural communities are that obviously preventative health coverage needs to be higher, and also that there's more chronic disease. Now, some of those to do with ageing. Let's get off the problem and start just at the end here to talk a little bit about solutions before we actually then have some time for questions. And I think I've got 10 minutes left, is that correct? Things are going all right with time then. I'm going to tell you about a couple of solutions that I'm quite passionate about. And when Lynn talks to you, she'll talk a bit more about the trials that their group have been running on the obesity area, which again give reason for optimism. So let's try to think in this space. When I talk about solutions, I'm trying to be, obviously I come to you as a professor, so I try to talk about evidence. So what that means is where I say things are good, it'll often be because there's been a randomised trial. That's generally what I look for to say that something works. And also feasible. It's a bit hard to be saying to you to do something that people in a university did as a randomised trial, but it's never been done in a rural area and is not feasible. So it's silly to be pushing things that are not feasible. So I'm looking for those two things. I want good evidence and that we've done it before and it goes well in a rural regional area. And these two things I'm going to tell you about are just two from the list, but they're both things that I think have huge promise. And I want your involvement in them if I can get it. So the first thing I'm going to tell you about is communities that care. Now, I volunteer my time as the Chief Executive Officer of Communities That Care, and we're working across Australia. I've been doing this now for 12 years, and Deakin University contributes my time. You can click on this website. I think these overheads can be made available. Thank you. And so you can actually look this up. I'm about to go from here to Warrnambool, where we're launching Communities That Care Warrnambool, and I've been working with Portland, and we're working in East Gippsland. We have a lot of rural communities across Victoria and Australia that are taking on board this model. It's a not-for-profit company, Communities That Care, you can see that we're under the Royal Children's Hospital website. What the Royal Children's Hospital does is, obviously it's one of the major child health campuses in the world. It actually does a huge amount of research. So what we're trying to do is provide a way to get that information into rural communities and other communities more rapidly. So we have a lot of people trained up who can do the effort of actually explaining some of the ideas of healthy development. One of the successes we've had is in the Mornington Peninsula Shire, where we've actually seen quite good reductions in youth alcohol use. They had a problem when they first started doing big surveys through the Mornington Peninsula Shire. They had higher rates of youth alcohol use at age 17. You can see the majority of kids were using alcohol when they started school back at that period, and you go back and think about the earlier overheads, and that makes sense to what I was showing you nationally. But they had a steeper reduction there than has occurred in Victoria. So we've been working across Victoria to discourage this. We're having a lot of success, but their drop was more rapid. And now they've done that through using a model that actually helps them to bring in evidence-based practices into their community. They've also dropped tobacco use in these age groups. They've dropped precocious sexual behaviour. They've dropped antisocial behaviour, and they've dropped illicit drug use quite spectacularly. And now as we're working, I'll be going and talking to Portland tomorrow about the same sort of model. I'm going to be talking to Warrnambool. And there's a toolkit that can be used to get these improvements in child behaviour. And we're going to be doing this in Geelong. So many communities are on board with the idea. We want the childhood years to be very healthy, and we want the evidence base to come quickly. And you can be involved in the boards that run communities that care, and that could be running in your community if it's something that you're wish to be a champion for. And again, we invite partnerships in these types of activities. The other thing I just want to touch on is sustainable farm families. Again, this is another program that has very good evidence, and people have worked very hard on this one. And it's another one that could be done by your alumni, by your college, and it could be something that you're trained in as students if you were passionate about this type of thing. The reason I present it to you is that, again, it's got very good evidence. It's designed to be flexible in rural industries. It actually does help reduce injury, obesity, mental health problems. It's been shown through good trials that it can do that, and it would be possible to use a train-the-trainer model. So I won't say much more about those. I think that's probably enough about that, and I just will throw for questions though, if I have time for that.
Yeah, we've certainly got time for a couple of questions. So,
Ian Blair, have you put your evidence-based feasible studies to Scott Morrison? There was a report on the way down here this morning, and they are talking about an investment model. Yours seems to be far better than that.
Yeah, well, the reason that I present these to you is because there has been economic costings done of the communities that care model, and the costings show that for every dollar you invest in communities that care, you are going to get a $5 return. Now, that's been based on randomised trial in the US, and what you're saying is perfectly true. In my position, I need to be out there talking to people to make clear that these preventive programs do work. They have a very good return on investment, and that's why if you invest in Pennsylvania, which is actually a very large state in the US, where they have 2/3 the population of Australia basically in one state, so it's a really good example. They're actually able to increase school completions, and now they're closing prison beds as a result of doing these types of programs. So as you said, we've got to get the message out there. This is a way to save the nation money, and we want to do evidence-based practice if we want to help rural regional areas to get ahead.
any more questions? Yes.
John Taylor Campbell. I just wanted, with all those statistics, I'm just wondering how or whether you have adjusted for, I guess, socio-economic status, because there's a big split. Obviously, the average isn't necessarily indicative of the whole population, if you know what I mean.
Yeah, that's right. Everything I've presented today has been adjusted for socio-economic status. So, the differences in alcohol are there. The 31% is after you take into account the socio-economic difference. So it seems to be not that. It's something that we could control beyond that. It's about, I suppose, trying to dig in. What is it, why is it that if it's not about socioeconomic status, then, let's go back to why is it that 31% more kids are using alcohol at a young age in country Victoria? It's not to do with SES, because we've controlled for that. So we have actually tried to study that to see what is going on. And one of the things that in one of our more recent papers we've found out is that part of it's about attitudes, about parental tolerant attitudes to alcohol. Parents sort of seem to have an attitude that alcohol is just part of the culture and it's going to be all right to drink. And I think we've got to change that. And, obviously it's trying to get the message across then and change the cultural norm. So part of it's about a cultural norm.
John, some of the stuff I've been reading is about facilities for young people, where you can get in some other people to look at young people in rural areas. And I was saying, in some rural areas, the social hub is typically would be a pub. There's not facilities there for young people to gather with non-alcohol or alcohol-free.
Yep. And it's another good point. The we do have a higher density of alcohol outlets in the non-urban areas, and what that means is there's more competitive pressure from each of those people who are trying to set up a business to survive and sell alcohol, whereby often the responsible service of alcohol is not as strong because of the market pressures. But what you're saying is true. Are the opportunities there for recreation outside of the alcohol environment? And again, it's something that we can probably work on as a within ourselves, within our community, within the effort we do together collectively to try and change that, because whilst there's not the opportunities in the city for recreation, there are opportunities, if we think about them, that are not there in the city as well, and so we need to think of that. There are strong, healthy opportunities. The other thing that I see with some rural areas, my wife is into cultural development, and we note the phenomena of sort of towns reinventing themselves around new industries to do. I think of Port Fairy, where I'll be going near Port Fairy, and that's a place where they obviously have the idea that they're going to change the way that they provide recreation, such that it'll become a magnet for people to go and enjoy a really nice experience with their festivals, etc. And they're often done with very strong responsible service of alcohol. And I think those sorts of role models show us that it is possible for rural regional towns to reinvent themselves and take charge of that issue of providing recreation in an environment that is actually really exciting.
Have you looked at the correlation between, if you like, contentedness? So the issue that I'm looking at here is the low rates of school completion and the high rates of abuse in alcohol, etc. Is it that we haven't got the right education for some of the people who aren't completing education? Are we not providing them with the education that they want to take them forward in their careers? I mean, a shearer doesn't need
Right.
to go to year 12.
Yep. Yes, look, I think that's true, that the sense has been that maybe you don't need really high. I mean, there might be more, let's put it this way, there might be more blue-collar jobs is another way to put that. And so, you don't need to complete education. I think, though, that we've got to question that. I mean, one of the things about education is that the schools have the chance to readapt themselves and to be able to sort of be more relevant in the rural areas. And I think that freedom and flexibility needs to be the challenge. Education's interesting because it provides you with an employment, but it's not just about that. Education's also a chance to learn, I'll talk about the idea of social emotional development, the idea that at each step you're actually learning how to have a debate, the more education that I gained, the more it became interesting for me to hear different points of view and to be able to listen more. I found that was something that was a skill that I could develop, and then to read and to be able to be really absorbed by what people were saying other than my own ideas is what education helps us to do. I think you need that, and it's good to do that, but it should be enjoyable. It should be something you want to do, and also it's interesting to see a really good school. There's no reason why it can't be teaching the rural skills. Here we have an enormous program that's running in this college, and that could actually be influencing what's happened in the rural schools. I'll better leave it there. One more? Okay, you're my master, so yeah.
There is being help too that secondary schools do offer for those people that want more skills on agriculture and things like that too. They don't have to go through to year 12. But what's being done with the primary schools? Because children, that's stability for some children. They're at school more than they're at home.
Yeah.
Is there things being done with teachers?
With primary school, what I see is happening now in the greater South Coast area, so I'm talking to them about some of the work that they're doing there, but they've decided that they're really going to try to reorganise the way school works, and it's taking up your point that it's not relevant what they're teaching some of the time, and it's got to be relevant. And I think that a lot of the kids are coming out of primary school, they've already made up their mind that it's not for them. They're saying that they don't enjoy it. They don't enjoy school. And we see higher rates of that in the survey work we've been doing in some of the rural regional areas, that the young people in primary school are saying that they're turned off by it. Now that is something that can be changed. Again, what's needed there is we've got to work closely with the teachers. We've got to bring the parents in partnership, but also we need to make sure that what's going on in the school is something very relevant to them, something that's very attractive to them. So I think there's work to do there, but it's an exciting bit of work because I think that it's something we could make a huge difference there.
Particularly health and well-being.
Yep. There's some very good programs in the health and wellbeing space now, and again I talk about social emotional development. Those skills are very attractive once you start to be in a school where the kids are not bullying each other, but they're starting to understand. With the Communities That Care program, what we say there is that it has as a core the idea of caring for other people. So that is what we're trying to bring out, that care notion. And when we study human development, we find in the positive psychology literature, we're actually altruists, it appears, by nature. Our brain is built that way. Amazingly, when you are being altruistic, your immune system functions better, and your community, your sense of community is one of the things that, as it increases and you're seeing that altruistic behaviour around you, your confidence and your sense that you want to play a role improves, and that's another way through that type of community building, to actually build up the solidarity and reduce the alienation and the depression. So Communities That Care is on about trying to bring out human potential that we believe is pretty fundamental part of the story of where Australia goes next. So it's very important that we come back to that and realise it is part of our psychology, it's the way we're built, and we've got to start to use our wealthy nation status to actually now step up and say, all right, what role can we play in being better beings, being able to be more successful carers for one another?
Thank you, John.
Good, thank you.